Hey guys, this is Dr. Hub. Today we'll look at the endometriosis and we are breaking it into two headings. That is, first is the site of endometriosis. So the site of endometriosis, there is the pelvic endometriosis. So under the pelvic endometriosis, it is the pelvic peritoneum. So what is involved? The pelvic peritoneum and the pouch of Douglas. There is a pouch of the Douglas. And there is also the uterosacral ligament. Uterosacral ligament. Next, the site of endometriosis, there is a rectovaginal endometriosis. Then comes the ovarian endometriosis. So there is ovarian endometriosis. There is also the chocolate cyst of the ovary, and there are other sites. So what do the other sites include? The other sites, it includes the presence of the appendix, the pelvic lymph node, and there is also the metastatic. So under metastatic, what is included? There is presence of the lungs, there is presence of the umbilicus, and there is presence of the scar endometriosis. So one pathology review revealed that endometriosis has been identified on all organs, so except spleen. So this is under research. So what they are telling is the endometriosis has been identified on all organs. So it is identified in all organs except the spleen. Now let's look at some examination findings of the endometriosis. So under examination findings, we look at the abdomen. Abdomen, what it includes? There is a cystic swelling. And it can be, there is fixed and tender. The tender. Next is we look at the pelvis. So under pelvis, there is a cystic tender mass. Then on the vaginal examination, there is fixed, tender and retroverted uterus. There is fixed, tender as well as the retroverted uterus. The tenderness is actually seen in the lateral fornices. It is seen in the lateral fornices, and this is indicative of the endometriosis even if no mass. So this is indicative of the endometriosis even if no mass. So on the speculum examination, inspection of the posterior fornix. So here there is a bluish blackish puckered spot. There is a bluish blackish puckered spots. So there is a bluish blackish puckered spots, and this is seen on the speculum, and it is tender to touch. And the presence of puckered spots is pathognomic of endometriosis. So this pathognomic of the endometriosis. So the posterior fornix palpation. The posterior fornix palpation. So under the posterior fornix palpation, there is a uterosacral ligament, and the pouch of Douglas. The pouch of the Douglas. So they feel thickened. And they are shorty with the multiple small palpable nodules. They are shorty with multiple. They have multiple small palpable nodules. And this is known as the cobble feel of the uterosacral ligament. The cobblestone feel of the uterosacral ligament.